Hello, my name is Robin Thompson, and I'm going to give you a brief overview of using BSIM for nursing fundamentals. So when you start your scenario, you'll have a screen that looks similar to this. It'll have a patient's name and it'll have background information on that patient. So you'll be able to take your time and read through. This patient is Rashid Ahmed. He is located on the medical unit. It's 7:30 in the morning. And this is the report that was given from the shift nurse. So you'll be able to read your report. And once you're finished reading your report as a team, then you're able to go and click See This Patient. This is going to pop up. It's going to say Allow Controls. You hit Allow. Once you get there, this is the report that you saw on the screen before. This is just a you're in the patient's electronic health record at this point. From there, you would be able to go and click any of the tabs in the electronic health record, just as you would be able to do in a hospital. You'll be able to see the patient's I&O, any physician orders that the physician has ordered. If there is something that's highlighted in blue and underlined, then you know that you can click on that. It will open up a completely different screen. It will take you to something called the Lippincott Advisor. Lippincott Advisor gives you background information on whatever it is that you clicked. So I clicked on nausea. It gives me background information on overview, history, causes, different conditions that the patient may have, a brief history on that. So we can always click the Lippincott Advisor, go back to our screen. We would just hit an X at the top. Blood pressure is another one. I&O is another one that's there. Sometimes they even have medications. If you're not familiar with the medication, you can click on the medication. It'll take you. Here's a medication, but it's not highlighted in blue and underlined. Therefore, I can't click on it. It will not take me to Lippincott Advisor. You can see up here we have blinking tabs, and some tabs are not blinking. So if it's not blinking, that means there's no information that's there. If it's blinking, that means it's something that's there. So we have, this is the patient's MAR, has normal saline recorded and the time in which it was given, and it also has a medication and how much medication was given and at what time it was given as well. Again, nothing is blinking under clinical observations, therefore there's nothing there. And then you have diagnostics. So we have some diagnostic findings here, as you can see. You can go through your diagnostic findings and review them and talk about them as a team to decide what's significant and what's not significant. When you're ready to see your patient, all you would have to do is click the X at the bottom, and it takes you into your patient's room. So you'll find a patient lying in a bed, and you will also find the nurse. So this is the nurse. You are the nurse. You will have something down here that says pause and fast forward. Do not use those controls. It is timed. So here you see time. This says 7:30 a.m. This is real life time. So it's not really 7:30 where you are, but it's real life as in minute for minute. So when this moves to 7:31, you will have actually been in your scenario for 1 full minute. You have up to 30 minutes to complete your scenario. If you do not complete your scenario in 30 minutes, it automatically times you out. So someone should be paying attention to that clock and keeping track of that clock and whatever time it is, because you only have 30 minutes to complete your scenario. From there are different tabs over here that you can select. You have a button down here called the provider. You have a button that says patient handoff, and you have one that says electronic health record. Let's go back to the electronic health record, because this is the exact same EHR electronic health record that we started out with. So anytime you need to refer back to your patient's EHR, all you have to do is click that button. Get back to your patient, you hit an X. Now let's go and review some of these tabs. So we can do things like you would do in the hospital. Wash your hands, identify your patient, put on your gloves, ask for allergies, and introduce yourself. So let's introduce ourselves.
Hi, I'm Daniel. I'll be your primary nurse today.
Hi, Daniel. Nice to meet you.
So we can talk to our patients, and our patients can also talk back to us. We can actually do interventions. In the hospital, you would wash your hands. So we're going to wash our hands.
I'll wash my hands.
Let's identify our patient. Will we do that in our hospital for real?
Please state your name and date of birth.
My name is Rashid Ahmed. I was born on July 12, 1965.
Everything matches.
We should also be putting on gloves, so we can do that as well. And we can ask about allergies.
Are you allergic to anything?
No, I'm not allergic to anything.
Now, the order in which you do these things are left up to you. That's a clinical decision making for the nurse. So you as a nurse, or you as the team of nurses, will have to decide what interventions you need to do, what communication patterns you need to have, and in which order you need to do them. So we can click under a new tab, communication, since we're talking about communication, and it shows us interprofessional, so we can call for help if we need it. Things that we can ask about for educating the patient. There are different things that we can ask about. Let's ask about ostomy care.
I want to talk to you about ostomy care.
But I don't have an ostomy?
And just as here, if it's not applicable to your
No,
patient,
you are right. Sorry about that.
your patient will respond back to you and notify you. Let's educate on positioning.
If you are not able to position and turn yourself in the bed, I would like to talk to you about how we can assist with that.
I can move myself without a problem.
So your patient kind of gives you
Yes, that is not an issue right now.
feedback as to what they need and what they don't need, if you're on a good pattern, or if you need to perhaps rethink some of your decisions. We can ask about pain. So that may be one thing that is applicable to the patient. It will be the same pain questions that you're taught to ask your patients in the hospital. Do you feel better? Time of pain, rate your pain. Let's ask them if they have pain.
Do you have any pain?
Yes, I have some pain.
And now let's get them to rate it.
How would you rate your pain on a scale of 0 to 10?
Not too bad. It's about a 4.
We can ask about current illness. These are questions that are there for the current illness that you can ask about. Past medical history. And then your client's orientation. Next is the assessment tab. We can complete a head to toe. We can click on any of these things, and you can actually click on body parts that you would need to do for head to toe. You can auscultate anything that's orange. That lets you know that you can listen there and auscultate. Let's listen to heart sounds.
Please try to be still as I listen to your heart sounds with my stethoscope.
Okay.
I can hear an irregular heartbeat, but the heart sounds are normal. The heart rate is fast.
So the nurse will let you know what assessment findings he or she has found. We can take vital signs, respirations. When we count respirations, we can put on a pulse oximeter. That information will show up down here with your pulse and your pulse ox, radial pulse. We can take a temperature, blood pressures. We can check the skin, pain assessment. These questions are the same questions that we saw under pain and communication. We can do a respiratory assessment. We can do a cardiac assessment. We can do a neurological assessment. We can do a GI/GU assessment. We can do postoperative assessments. And we can do an integumentary assessment. All of those are assessments. Sometimes the interventions, you would think that's an intervention, but that's what's listed under the assessments. Under intervention, we can do comfort measures. We can do positioning the patient. We can do respiratory interventions. We can do oxygen therapy. cardiovascular interventions, GIGU interventions, and integumentary interventions. We have drugs. Well, if we click on drugs, it will show us our patient and what, if they have IV access. If they do not have IV access, we can start IV access if we needed to. Here, this patient does have an IV. It gives us an option to remove it. Or if we wanted to start another one, we could click here and it would insert another IV access. We can flush our IV and we can assess our IV access. If you want to place an NG tube, we can do that as well. Or if we want to assess or do some type of intervention on the NG tube, we can do that. And then we have drugs and fluids. So there are a number of drugs and a number of IV fluids we can give our patient. We could just go through and we can click on any of the drugs and any of the medications. Let's say if we wanted to give our patient, and after you click the drug or the medication, it makes you make a decision as to how much, how often, what route. Let's click on iron. Iron is an oral medication. I can click oral. Now it's going to ask me how much iron I want to give my patient. Let's give him 5 milligrams of iron. It asks us if we want to compare it to our label. It asks us, do we want to go back to our EHR and look at the physician's orders? Or it asks us, do we want to administer? Let's just administer.
5 milligrams of iron has been given.
So that's a PO medication. Let's try IV fluid. So now it's going to ask us whether it's a pump or a bolus. Let's say we're going to give a bolus. Let's give it over 5 minutes, and let's give them a 300 milliliter bolus. Same things, orders, compare with MAR, and administer.
An infusion of 300 milliliters of lactated ringer solution over 5 minutes has been started.
We can also do tests and diagnostics. We can take blood sugars and we can take a chest x-ray. It will call in a team to do an x-ray, and it will give you back x-ray reports. You can go back to your EHR, look under, I think it's under the radiology tab. Yes, it will be under the radiology tab when the results come back, and it will give you information as to what was found on the chest x-ray. If you want to do a blood site glucose, let's do that.
I'm going to stick your finger to get a drop of blood to measure your blood sugar. You will feel a prick.
Okay.
The glucose is 87 milligrams per deciliter.
So these are all our tabs. The only one that I did not go over is the search tab. So if you can't find something and you know it's there, you can search. So let's search respirations. So it tells us if I start typing respirations that I can do, it's under assessment, vital signs, or I can go under assessments for respiration. So if you do get stuck and say, hey, I know I could do it, I don't remember what tab it's there, just go to your search feature and use your search feature. Search it and let vSim actually help you in caring for your patient. We didn't connect anything. I guess we can connect the O2 so you can see that as well, what that looks like under assessments, vital signs. Let's put on a
This
pulse
is a
ox.
pulse oximeter, which monitors the oxygen level in your blood. It fits snugly around your finger, but should not hurt.
Okay.
Now we have a pulse and we have an O2 set. So that's what we do. Once you're finished with your patient, you've done everything that you need to do, you're going to click, or time's out. Hopefully we won't time out because we have 30 minutes, remember. So if I'm finished, I've done everything that I think I need to do for this patient. We feel as if there's nothing more that we can do to help this patient. We've carried out all the doctor's orders. We've done all of our assessments and our interventions. We're confident that we're on the right track, and now we just need to monitor our patient. You would click patient hand off. Once you get to this point, there is nothing more you need to do. You need to raise your hand. Do not click yes or no. You stop. Raise your hand. Someone will come in and they will tell you what to do from that point on. If we were to continue, and we won't, but if we were to continue, what we would see next is the actual score and your detailed information. But you will be able to review that once everything is complete. This is an overview of vSim fundamentals. Good luck.